Reserved for the most severe cases, a permanent tracheostomy bypasses the nasal passage and mouth, creating an airway in the throat. Tracheostomy. Imaging studies revealed displaced fracture of the synchondroses of the base of the dens. Synchondroses. Some patients also have too few red blood cells and a splenomegaly. Splenomegaly. Some of the fibers also pass through the fissure to the spine of the sphenoid bone. Sphenoid. Her initial chest examination reveals coarse rhonchi in both lungs. Rhonchi. The extensor retinaculum is attached laterally to the lateral margin of the radius. Retinaculum. She was fitted with a prosthesis to replace her missing leg. Prosthesis. Bones are covered by a connective tissue membrane called the periosteum. Periosteum. This passes gradually into the thinner-walled parenchyma of the inner cortex. Parenchyma. Speeding up healing of wounds is likely to reduce complications such as infections and tissue necrosis. Necrosis. A group of medications called mucolytics, which break down the chemical bonds that make mucus thick. Mucolytics. Monoclonal antibodies are used to fight cancer cells in the same way as antibodies that are produced by the body's own immune system work to fight infection. Monoclonal. The metaphysis and the periphery of the secondary center of ossification were red marrow. Metaphysis. The lower two parts, the oropharynx and the laryngopharynx, are involved in the digestive system. Laryngopharynx. This antibody, also called immunoglobulin, may damage the nerve fibers. Immunoglobulin. A bunion, or hallux valgus, is a problem that affects toe joints, most often the first joint of the big toe. Hallux valgus. Carly, who had a fasciotomy in her right leg 2 months ago, had already began running. Fasciotomy. Her personal history revealed no pathology except for occasional epistaxis. Epistaxis. For identification of the pathogen, a slide agglutination test with the corresponding antiplasma was used. Agglutination. Over the next 24 hours, his hemoptysis continued. Hemoptysis.